that came in while you were discussing this. An individual who's watching right now was asking about a situation where he had a transurethral resection of the prostate 15 years ago, and he's still having urinary urgency. And he just wants to know, is there some type of therapy that can help after this long period of time?
Yeah, so I think urinary urgency after transurethral resection of the prostate is relatively common. And I explain it to men a lot of times in that it may be related to the fact that he had a very large prostate and the bladder was sort of working against this large prostate for many, many years and decades. And it's possible that there's been some remodeling of the muscle tissue that now is causing that overactivity. Yes, there's absolutely therapy that can be pursued, although his TURP was already performed, it was performed 15 years ago. And so, number one, we got to make sure that that prostate still is okay. There hasn't been regrowth of tissue and that he doesn't need more prostate treatment for that. But if that's not the case, then we also have to sort of take a significant, very thorough history, possibly do some additional testing and determine if he might be a candidate for oral medications, physical therapy, PTNS or Botox injections, a lot of different options for overactivity of the bladder. If that's the true diagnosis.
And Dr. Schaffner, just out of curiosity, do you think there's a role for maybe rapid fire Kegel exercises in individuals like this or some other option?
There can be. So some people, we see urgent continence all the time, and it can be a structural problem, but it also can be a behavioral problem. As we talked to early, part of our pelvic floor we have control over and part we don't. And so it is functions under the autonomic nervous system, so our fight or flight nervous system. So if people tend to tap into that, fight nervous system or fight or flight sympathetic nervous system too much, we can get anxious. And so we feel that first urge, and then people get more anxious. It fires up their nervous system some more. Their bladder gets more hyped up and more overactive, and then they got to go. And so one of the things that we look at is calming their autonomic nervous system down so that they're not fighting against themselves. So when they do feel that urge, it could be a little bit, I hate to say psychologically and behaviorally driven, but it can be. And so that's where one of the functions of the abdominal breathing comes in. It helps calm that system down. But then we do a lot of self-talk. So one of the things I will tell people, especially at night when they have to go to the bathroom, number one is stop drinking water 2 hours before bedtime. Your kidneys and your organs are meant to sleep at night as well. And so if you are you're trying to catch up on water for the day and you're dumping a ton of water in at night, that's not the time to do it. Start at breakfast and carry on before 2 hours before bedtime. And just take whatever water you need for medication. So one of the things is waking up at night and they're like, I gotta go. I'm like, well, you need to calmly tell your bladder that there might be a bear in front of the bathroom and he doesn't leave but once a night. And so we give them some breathing exercises. We give them some self-talk exercises. It may be rapid Kegels. You will hear those called knacks sometimes, which basically means turning your pelvic floor on and off very rapidly. That doesn't work for me. Long pelvic floor holds work for me. So if I really got to go, I can kind of do a sustained pelvic floor hold until that urge passes. And then I talk very nice to my bladder. And I know that sounds ridiculous, but it does work. And I just tell my bladder, hey, listen, here's what we're going to do. We're going to walk really calmly to the bathroom. We're going to be super calm and I'm going to breathe while I take care of my undergarments and, sitting on the commode. Which leads to another point. We women, we only sit for the most part. Hovering over a toilet is awful for our pelvic floor because it doesn't let it completely relax. But for guys, they may be storing sometimes. They may not be completely emptying. And so in those cases, that can lead to that urge because there's a residue that's left behind that they aren't fully emptying. So that's another behavioral thing. Oftentimes I'll say, hey, I know you're used to standing, but have a seat. Let those muscles relax completely so that you can fully empty out your bladder and nothing's being left behind. So,
Well, moving on that same train of thought, do you have any other supportive or long-term services that you might think will be helpful that you can offer for cancer recovery?
we do. So, unfortunately or fortunately, we've had a couple clinicians at the clinic who have been through cancer treatment, myself being one of them. And I've got one or two other clinics. So we understand the journey of having had cancer, the post chemo, the fatigue, the whether you have confusion, neuropathy, the neuropathy that can happen after chemo, especially if you've had to have chemotherapy, can impact your balance. The fog and mental confusion can also. So we offer all kinds of therapies to help restore all those functional limitations and reduce those limitations for patients, whether it is balance, the fear of falling, because obviously if you've got neuropathy and you can't feel your feet as well and your balance isn't as good, and then you fall and break a hip, that's a big problem. That's a big problem. So we try to alleviate those by providing services to alleviate their joint pain, get them back into movement, help with appropriate weight management. Some people gain a lot of weight with cancer treatment. Some people lose a ton of weight. There is a spectrum on there. And so overall health management is something we can do some counseling with dietary needs, different dietary needs to help with it if they're obese or if they're underweight, while we're getting them back into getting the muscle back on them and getting them stronger and moving back into life.
And just out of curiosity, do you have any role